Good afternoon, everyone. We at Cache Software would like to thank you for joining the webinar this afternoon. As you can imagine, the webinar platform itself is being heavily used. If you're having issues staying logged in or it seems sluggish, please be patient and know that you might need to log back in. We recommend that you do view today's webinar in full screen mode. This can be done by clicking the full screen button on the webinar's control panel. Use that orange arrow for collapsing and expanding the control panel. We do encourage you to use the question feature located on the control panel to type and send any questions that you may during the presentation. All attendees are muted as we are recording this webinar, and we will be sending the recording to you in a follow-up email within the next few days. At this time, I would like to introduce our presenters, Prabha Manavasagar, our president, Sam Frederick, our product manager, and today we have a featured guest, Andrea Lefevre. Prabha, it's all yours.
Thank you, Christine. Good afternoon, everyone. Thanks again for joining yet another webinar from the Pavillio series. Today we have a special guest, Andrea, who is joining us. Thank you, Andrea, for joining today and your willingness to share your experience and the success you've had with Pavillio. Let's dive right in. Oh, by the way, we also have Hemchan on the call. Hemchan, who is part of the product team, and he's always here to help answer questions. And Hemchan will chime in when necessary. Let's start with Andrea. Andrea, once again, thanks for joining. Andrea, tell us a little bit about yourself and your experience with Pavillio and Cache.
Yeah, absolutely. Hi, everyone. My name is Andrea, and I'm a project manager with Midwest Independent Living Services, also known as MILS. I've been with them for about 2 years, and we are a community-based service provider with just over 100 clients and nearly 100 caregivers. So, you know, we're very comfortable in the NHS, employment supports, respite, and homemaking services. We have been on Pavillio for 2.5 years now, and with any change, because before we were on paper in every aspect possible, it was slow, but moving to Pavillio and all of the benefits has really saved us time, and we've scooped some cost savings as well. So it's been a very, very positive experience.
Andrea, thank you. Andrea, one of the things that, you know, when we spoke that you highlighted was the need, and I put this in there, the project manager, also known as the champion. Talk a little bit about the champion role and why that is an important aspect of rolling out any software for that matter, Pavillio specifically, and how that's helped the implementation be successful.
Absolutely. So when I first started, there were about 3 or 4 of us all in the kitchen working together with the Pavillio implementation and troubleshooting, and it just became very confusing for everyone involved, not only for the office staff, but for DSPs as well. So probably in November, I became the quote unquote champion, and that was able to streamline communication with our staff as far as new features or trainings, but then also that made communication with Pavillio much more streamlined as well. So with reporting any service tickets or issues, there was one point of communication, and it really simplified the process.
Fabulous. Yeah, and I know that many of you on the call have taken that lead and have had internal support or internal champion that has really helped with your implementation as well. Andrea is going to really help talk today about how they have adopted the platform and have really enhanced their efficiency within the organization and some lessons learned along the way, and hopefully you'll find this informative. Again, thanks for taking an hour out of your day to join us. Let's jump right in. Sam, you've got a agenda here that the majority of our discussions around the successful use of Pavillio by an agency and the tips and the lessons learned, and you'll hear a lot from Andrea on this. I also want to give you a quick update on EVVs on everyone's mind. I want to make sure that we keep you updated as we've done in the past, and also This is a fun one for everyone, and everyone asks about this all the time. And what's coming rest of 2023? Boy, the dev team's been super busy. There's a lot that's happening, so we'll tell you a little bit about that as well. So let's dive right in. Samantha, give us the regular EVV update.
Yes, hello everybody, welcome. We did have, we just so happened to time our webinars, it seems, right after the DHS quarterly update, so it's a good time for us to share those pieces of information with you. We do have roughly 55,000 active EVV users across both, all three of our platforms here, all the Cache platforms. So we are heavily used in the marketplace here, and we do, connect with HHA, and we follow all of these issues very closely. The MCO integration is still going strong here. We're not aware of any issues, but we're still, working with HHA and DHS as needed to make sure everybody's connected and good to go.
And MCO, we are already we are attempting to send, or we are sending some MCO information to the aggregator now, right, Sam? I think we already started doing that.
Yep, correct.
Okay.
Yep. DHS announced we were expecting the skilled services launch in the fall here, but they have said the soft launch will start October 16th for all of the skilled services in the state. The geofence changes. So as you're aware, the geofence boundary that DHS set previously was 500 miles, and that was not approved by CMS. We discussed last time they are changing it to 500 feet, but they did recently announce that the date that will start is December 1st. Within the system, we will automatically make that change. There's nothing that you need to do there. And you, at your agency level, you can set it to less than 500 feet if you choose to do that, but it can't exceed that 500-foot range. The live-in caregiver requirement, this was also a policy they released last time. We have implemented this in Pavillio, and the big unexpected piece of this was that the live-in caregiver does need to clock time daily. So we have implemented some of those changes in Pavillio to indicate to you if they punched their time or added their time daily, then that's okay. There's nothing more needed on that. And we have that box, of course, to designate the live-in, but if they are adding time that's outside of the daily, then you will still get a warning on that. And we do have an information guide in the help area to give you all of those details.
One thing that I would like to add there is the live-in caregiver designation. There is, DHS hasn't clarified how the attestation for a live-in caregiver needs to happen. That still needs to happen outside of the system. In the future, if there is an opportunity to improve process, we will modify the system. But right now, we encourage all agencies to use the live-in caregiver function so that you will reduce the number of exceptions within the system.
Yeah, correct. And just to add on a little bit to that too, DHS, from what they've said as far as that attestation piece and making sure they are a live-in, there is some documentation that they're requesting agencies maintain for those caregivers. And that's why, it can't just be an in-app, yes, I attest I am this, because you do need to have those verifications. Community visits. This is something that's new to us. We're just developing this in the system as well. But basically what this means is instead of the caregiver punching at the service location, yes, I am at the client's home, I can say I'm in the community. And then the system will not validate that location against any location that it doesn't have anything to validate against. Simple as that. So what will happen here is the caregiver will indicate they are in the community, and the coordinates will be captured, but it won't be validated against anything. You won't get that beyond geofence warning. We don't have this in Pavillio yet, but this will be coming soon. Rob, anything you want to add on this?
Yeah, so this is the latest guidance from DHS, and we will, in the upcoming next 2 to 4 weeks, we'll have a app release that will address this, and we'll have the community designation within the app that will then comply with DHS's requirements. So this is just something very new that they came up with, but we will abide by that very quickly.
And then lastly is the televisits. This is the IVR alternative to EVV on the app. And again, DHS has said their app first. So the app is, of course, their preference for those without a device or without internet connection. This will be the alternative. And this is in pilot stage now and will be available in the next probably 4 weeks or so at the most to get that started if you need that.
Yeah, and this is included in your subscription to Pavillio. You can once we roll it out, you can start using it. Our philosophy is that this is a sort of the last ditch effort. If you can't get it to work with the app and you have no choice but to use a phone, then use this. But the app provides so much more in terms of benefit to the caregiver and the clients that we certainly encourage and put all our efforts into enhancing the app. Televisits is going to be sort of bare bones.
Yep, and this does need to happen from the client's landline too, so that's another barrier to the televisits.
Yeah, so this is we will have more on televisits, but the key being that this is not a if you have a mobile device, then if you have a mobile number, then you need to use a mobile device. You can't use a mobile device for televisits.
Yep, correct. Okay, back to you, Prabha.
Okay, great. So someone asked me, how did you guys come up with this? Why are you doing this webinar? What's this webinar about? And I thought I should at least give you the rationale behind creating this webinar. A lot of this had to do with us recognizing that within the system, within the platform, not everybody was using all the capabilities in the platform and not using the platform to the fullest. This was evident in the support tickets that we got, the questions we got, as well as what we can see within the system. We can see that people aren't using all the capabilities, and some agencies are very bare bones. They just use it for billing and EVV. In fact, we had a call from an agency saying, hey, we just use it for EVV, we don't use anything else. And so that led us to then say, look, we gotta share with people all the hard work and capabilities that are within the platform really benefits an agency. Let's put together a webinar that helps convey that. And what better way to do that than to have someone like Andrea, who in her own words can describe how that's helped her agency and how she's put it to good use. And so that's why we started. Another thing that was evident is, Sam, the next bullet up is implementation. Let's pop up the next two bullets as well. Implementation is not easy. When you go through implementation, as soon as you're done, you're overloaded with information. It's not easy to adopt everything that we say. You forget stuff that we have talked about in implementation, and it's also very difficult to transform processes. So that then created another reason that people don't use all the capabilities. And the third one is we are notorious for putting out new features every 2 weeks. We have bug fixes or new features coming out every 2 to 3 weeks, and the dev team is super busy pumping out new features, and that doesn't help the situation either, which is we have capabilities that you may not know about. So that is the reason that we said we got to do a webinar that really talks about how to maximize the system. And we'll do many more of this. I like the idea of the customer series, and this is the customer series. Here is Andrea, who is going to talk about some of the things that mattered most to us. We'll do more with other segments of the business, whether it's employment services, day programs, group homes, and PCA programs. So we'll have others in the future, but this is a good starting point. So what can you take away from this webinar? Let's see. The first thing is Andrea's experience. She's done it. This is her words. I'm going to ask her to share with you her true experiences, and she's going to do that. And also, hopefully, you can walk away with one, two, or three different three things that you can take away in the platform that you can implement right away. Hopefully, that's what you would. There would be some aha moments as a result of going through this webinar. And the third item is Christine and Samantha put together some really nice handouts, and these are on payroll process, on eligibility best practices, and approved visits best practices. These are handouts, just a way to help you adopt the platform better. They've put that together. And finally, upcoming features and what you can expect here in the next 2 to 3 months. Okay, so before we dive into the details, I thought we'll do a quick poll. So the poll here is, which one of these functions do you still have manual spreadsheets or processes that you have today and you would like to automate? Check the ones that apply to you, and we'll give everyone about 30 seconds here to go through this. We realize people have a lot of spreadsheets and they do things outside of the system. Tell us which ones you have, and that would be helpful as we improve the platform, as well as we go through this webinar and talk about areas of efficiency.
While you're doing that, one of the things that Christine and I are really trying to do, like Prabha said, with those handouts is provide additional guidance on all of the features and make it more user-friendly for all of you. So look for some additional material in the help area, just so we can provide, a lot more of the guidance or best practice or bullets along the way to help you out with those.
Okay. Christine, do you have a poll result? Okay, let's see. And by the way, this is not just, you can select more than one item. So, these are all areas where there are a number of you that say, hey, there are lots of spreadsheets and manual processes. Hopefully you'll find this webinar useful, because many of these things are the items. Andrea, would you agree that you've had spreadsheets or manual processes that you've automated?
Correct. Yep.
Okay, perfect. Let's dive right in. Sam, where would you like to? We're going to start with let's have the list of items that you have. Okay, these are the areas of efficiency. Let's start with EVV being the first one. EVV is tedious. It is difficult to implement. You've got many moving parts. You're trying to get people to make changes in their behavior. Now, all of a sudden, you're an IT shop trying to answer questions of your caregivers and employees. And Andrea, you went through the process of implementing, and you pretty much have all your employees using EVV. Tell us about your journey and how you made this work.
Yeah, absolutely. So first and foremost, Pavillio took the brunt of the load of the tool aspect, right? We didn't need to worry about the what. We got to focus on the how. And so we started the year off by strategically implementing chunks of different times and different milestones so we could focus on that. And essentially, it allowed us to take it slow and sustainable, so that staff wouldn't be as overwhelmed. I mean, we expected some overwhelm, but we gave ourselves enough tarmac to take off without a lot of stress. And so by the end of the summer, we have trained all of our staff. And I'm not going to say it was, pretty the entire time, but it made it much, much easier having the Pavillio tools, especially the new app has made it really, really nice.
Andrea, what would you say is the single most important thing that made the implementation of the EVV rollout successful for you?
Definitely having a Pavillio champion, having that one point person was crucial. So this, staff had one person to go to, and or whenever we encountered issues, there was one person reporting that back to Pavillio. So there wasn't 7 tickets going in for the same issue. It made it really streamlined. And also, within the help section, there's a handout that has step-by-step process of how to utilize the app and EVV, because some of our staff really like that type of instruction, and that was really nice where we didn't have to do that. That was already provided. So it's been nice having Pavillio in our corner.
Excellent. And, thanks for reminding me about that, Andrea. One of the things that we are doing is we are taking the instruction that the guide that we have in Pavillio, and now we are translating that to multiple languages. So clients and caregivers that are comfortable in a different language would have a multilingual version of that guide, and that would help definitely some of our customers. In terms of benefits, I've always said this, the fact that CMS wants to have this EVV data is not the real powerful thing. The real powerful thing about EVV is just the electronic version of the visits that really streamlines and automates and simplifies. What would you say are the benefits to mills, and how have you translated that to efficiency, Andrea?
Sure. So administratively, it's nice where, when the shift is occurring, it's being entered into the system and we're not waiting 2 weeks to enter in what's been going on in the ground. And, I'd like to think we all have great memories, but as we know, like over a 2-week period, things can fall through the cracks. So not only is there transparency of what's going on, but the quality of data that we're seeing and we're able to bring to the meetings is a much higher quality than it was before. As far as progress in certain programs and actual major wins on the ground, because when they're doing their time cards that day, it's all fresh in their mind.
Fabulous. That's and one of the some of our customers who use that start using EVV just to comply with EVV, when they start seeing some of the benefits, it's a big aha, and hopefully the others will also, when they realize that there is more to EVV than just checking the box and sending the data to the aggregator. Well, good. Let's move on to the next item on the list, admin notes. Admin notes, this is a feature that we have within the system. Sam, can you give people an idea of what admin notes is? Some may not know what it is, so could you just show them an example?
Yeah, so in each client or employee profile, you have on the summary tab, the very first tab, a place for non-clinical notes. So I can come in, create admin note, I can select a tag, client has a spend down, can add in whatever your note is here. You can also make this admin note a task, so you can check this box and I can assign it to Prabha, and I can say this is due by Friday and create that note. And then if I assign this as a task, it will also provide a notification to Prabha to say, this needs to be completed, make sure you get this done. And that is, like I said, available both in client and employee profiles.
So this is we added this feature, and we didn't, not many people use it, but when we were talking to Andrea, she and Mills have taken this to the next level in terms of how much they use it. Andrea, can you talk to your experience of how you've put admin notes to use and what functions or processes you've automated or eliminated?
Absolutely. So this has been crucial for our team because half of us are in the office and then half of us are still remote. So we've really used this as a communication tool with respect to keeping track of meetings, support plan expirations, internal audit processes, because before we were getting caught in a bunch of different email chains of who's doing what, when, where, how. And here, as Samantha demonstrated, as far as who has the task and when it's due is very, very clear. And when the task is completed, it is still stored in the system as, I believe it's a closed task. So you can track previous meetings, when they occurred, who did it. It just allows for greater transparency and fewer issues as far as who's doing what. And we did move away from using it within as far as notes, just because the task would get lost within that. But I do believe that there's something coming down the pipeline that may be modified, right?
Yeah, Andrea, thanks for teeing that up. We do have some enhancements that are coming for admin notes. In fact, that is based on Andrea's feedback, as well as a few other customers who've asked for some additions and improvements to the admin notes. We are enhancing this so that this becomes a more full-featured capability, which will allow you to not just assign it to an employee, you can tag other employees who can be who can monitor or be notified. You can attach documents, and also if you wanted to say, hey, here is an important note that you want highlighted, then you can highlight that note. As you can see, the second image there, that's the red or orange color. So you can highlight it and keep it on the top of the list of notes so that you can see the important notes right up on top. These are coming here in the next couple of months, but the admin notes is a great way to improve communications within the team, internal staff communications, without keeping PHI data in emails and spreadsheets outside of the system. And this is a great way. There are a few agencies that really they rely on this. And in fact, once we made a change and tweaked something, and I got calls from 3 or 4 different agencies saying, hey, you know, this you made a bunch of changes, and you know, that's affecting our operation. So we realize that those that use it heavily. If you don't use it, please take a look at this, because this can improve internal team communications and tracking of information that's not clinical in nature, but it's administrative in nature, and attach it to a client or an employee. Okay, let's move to the next one.
On that note, we do have a poll on this, Prabha.
Okay, go ahead. Do you use admin notes in the employee or client profile? A quick 15-second poll here, and let's see what people say.
And I did forget to mention that we do utilize that feature in the employee profile as well, for making sure we have current insurance for them for driving purposes, and then employee reviews, just because we have a few different supervisors kind of sharing DSP, so then it's clear, hey, I'm doing this quarter review, you get the next one. Very beneficial.
All right, that's you know, I'm happy to see that there are more people using it occasionally and always than I expected, and there are others that 40% not using it, but hopefully you'll be able to after this webinar find ways to utilize this. And there are tags, and someone asked the question here, can I add more tags to the admin notes? Absolutely. The tags that are in there are sort of the standard tags, but you can add whatever tags you want. That way you can organize the data based on what works well for your agency. Okay, let's move on. That was admin notes. Service status. Sam, talk a little bit about service status and what it is. Show people what it is. You know, we built service status because we saw that we have this information. There are agencies that are, you know, sometimes not aware that certain things have happened and someone is not able to be served. So we created this concept of service status. Sam, can you walk through what service status is and how it operates?
Yeah, so service status, in the current client screen, we have a column called service status. We've got ready, partially ready, and not ready as available options, and there is a filter up at the top to allow you to select just that status you're looking for and filter for those. But what this means is, for a client to be ready in Pavillio, they need to have a service agreement, a care delivery, and eligibility. And in this case, you can see for each of the service lines, homemaking, PCA, case management, there is something missing in these services to make this person eligible. So for eligibility, we have the waiver type is also included here. So if the waiver is a mismatch from what's on the service agreement to what is coming back for eligibility, it's going to tell you that right in this information icon. So this person has a waiver that is not coming back on the eligibility, so you've got a not eligible, or care delivery is missing for these services. So in order for the person to be eligible for service, for the caregivers to clock in seamlessly, it's best to keep these up to date and make sure that you're checking any that are not ready or partially ready.
Andrea, how are you using service status to streamline operations within Mills?
Yeah, so we typically look at this the first of every month, and we've gotten to a point where there's very few surprises, luckily, knock on wood. But before this, how we came across issues, whether it was care deliveries, essays, or eligibility, it was the dreaded text or call from a DSP out trying to clock in, going, hey, I can't clock in. You're like, oh no. And that's the last thing you want, is your care getting interrupted. It's just confusing for the staff as well as the person served. So this allows us to review our eligibility and all the other things that go with it, 2 minutes each month, and it's really streamlined that aspect.
And in doing so, what we realized is the eligibility component is a big part. Sam, can you talk a little bit about the eligibility options and what's available, what eligibility you can see for a client, and how agencies use that?
Yeah, so we have MA eligibility. So you could see this tag up here right under the name is MA eligible. And that means if their MA is active, that's going to say eligible. And it will tell you the service types that the person is eligible for. There's also waiver eligibility. And this will tell you, it will be a partially ready status if it is the waiver mismatch. So if I have my CAC waiver on the service agreement, but this person actually has elderly waiver, the system's going to let you know that there's an issue with that, so that you're not, trying to bill out things that you then can't receive payment for. And again, with eligibility, this does tell you who the payer is. That will change sometimes, at the start of a month. So it's good just to check in the eligibility here, look at your service status. And we do have a report in analytics that will give you the mismatch between the health plan, the payer, so that hey, my payer was Medica and now is UCare. I need to take a look and see what this should be.
So the key here is eligibility information is available from DHS. You have service information and what services you provide for a client. And if there is a mismatch, then the system needs to update you, and that's what we have done. So otherwise it's just data just sitting there without really solving a problem for you. And in this case, the system monitors that, and when you do have a eligibility mismatch between, say, the waiver and what services you provide, then the system is going to let you know that the client's partially ready. And if it's partially ready, then you would go in and check to see why, and then address the issue. Andrea, how often do you use the service status, and how long does it take for you to go through this?
Yeah, typically we just do it the first of every month and less than 2 minutes. So it's really quick, really quick.
Excellent. Sam, there's a question that came in here about eligibility. Is there a way to see PMAP type eligibility such as MSHO and MSC Plus? I thought we have that. Do we have MSHO and MSC Plus in the eligibility?
We have that as a report. I don't know if I have it in pre-prod here, but under the reports tab on the left-hand menu in client, there is a report in there that does display the PMAP or the health plan details. I think it is called health plan details. And we created this report for with the post-COVID changes and people having to reapply for their health plans. Some of the MA eligible people are now going to Minnesota Care or other plans. So we did add that report fairly recently. So go ahead and check there. If you aren't finding what you need, send an email to support and we're happy to help.
Yeah, and Nicole, you asked the question, looks like we do have it. I wasn't sure because this is something that recently came up, but looks like we have a report for you. Okay, great. Moving on, Sam, that was service status. Let's talk about approved visits. Approved visits is a area that we've spent an inordinate amount of time and energy, because guess what? you guys told us that we needed more efficiency in approving visits. Since visits are singular in nature, whereas timesheets had 14 days on it, approving visits requires a lot more scrutiny, and it's 14 records that you have to look at. And there are things that you need to monitor and figure out, for example, overtime information. And all of that meant that we needed a better way to do it, and we redesigned approved visits here in the last 3 months or so. Sam, can you bring up approved visits? Andrea, you've been a big proponent of approved visits and how it works. What are some of the benefits that you have gained in the approval process?
Well, I definitely think the idea behind it of making it more user-friendly is definitely achieved with the recent enhancements. I know we really use that send notification in that incomplete tab all the time to notify staff of shifts that need to be addressed. Also in warning, we're really lucky to have, like I said, great staff where, issues that we typically see is just when people forget to clock out. So, a 2-hour shift comes back at 13 hours and they accidentally submit it. So then we're able to change it back to draft for them instead of deleting all of that data. Because as we discussed, most of our individuals are doing EVV and we don't want to lose that data, right? The real-time clock in, clock out, and the GPS coordinates. So instead of deleting it and having them do a manual entry, you can just change it back to draft. They can adjust and then resubmit. That's been a really nice feature to have.
Fabulous. And I'm reading a comment here from somebody, Pakao Yang said, I absolutely love sending push notifications to my clients and staff. And she said that, well, sometimes recently push notifications are not working. Pakao, we did have an issue with push notifications. Hemchand, you're on the call. Do we still have issues with push notifications, or have we fixed it?
Yeah, we fixed that.
We have fixed it. Pakao, if you're still having issues, please contact the support desk. We did have an issue. This had to do with some changes in how push notifications were working for Android and iOS, and we had to make some changes on our end, and we did fix it. So please call the support desk and we will help you figure that out. Sam, in approved visits, I can't emphasize this enough. There's a tremendous amount of streamlining that we did, and agencies that have started using approved visits from what we had to what we have now, they have really seen some improvements. Sam, can you walk through what the design is and how it's intended to be used, and what are some of the features of approved visits?
Sure. So we have streamlined the process to be very fluid from left to right here. First, you've got incomplete, and like Andre said, you can send notifications. If everything looks good, you'd select the record and complete it if necessary. Once records are completed, they would move into warning. And here the system will alert you to a series of warnings all listed out here. You can verify these records, you can edit the records, you can change them to draft and have the caregiver fix them should that be required. If all of those look fine, say they're manually entered time and that's okay, you can go ahead and move to pending approval. And once the records are in pending approval, you can do a series of things here. We have this group by option where you can select either client or employee to see how many hours were worked by the employee, how many hours were served for the client. We have the option to select a record and also change to draft from here, or you can place it on hold. If you're waiting to hear back from the caregiver on a shift, you can place that on hold so you can move forward with finalizing any of the other records. Also, we have this feature called Payroll Week, and up at the top, there's a little checkbox called Payroll Week. You're going to select the payroll week. We'll use this one and search. And then your options here change. They are automatically grouped by employee, but what you're going to see is the total regular hours and the total overtime hours for this employee. And if in this case, I only have one employee for this example, but if I had all of my employees listed here, I can filter by OT And I can bring all of my people that have overtime up to the top, so I can deal with all of those first. And I can even place all of them on hold. I can select all of my overtime folks and I can place them on hold. I can move forward with dealing with all the rest of my records that I need to finalize, and I can come back to my records on hold and work through those then one by one. We also have a time card view here. When I click this time card view button and the plus sign, I can see a calendar view of all of the hours worked by day for that week.
And this particular feature, I love seeing this. Vanda, one of our customers, was the one who said, hey, I want to see this in a time card view. And I didn't realize how valuable it was till we put it out. And because of her request, we have this put in, and a lot of people use this because this visual view of the time card is very helpful.
Yeah, and one other thing, Prabha, while we're on this screen, we do have this new field called processing errors. And what is going to happen here is when you finalize all of your records, if I select this and finalize all, I can select all records, as the system processes them, if there are errors, they're going to go into this processing errors card. So you do want to be sure after you finalize all of your records that you don't have any in processing errors.
Yep, good thing to point out there, Sam. Sorry, did you already talk about the hold?
Yep, I did cover hold.
Okay, I was trying to answer some questions here. So in terms of approved visits, if any one of you on the webinar here need more assistance, we're happy to help you. We also updated the platform so that you can select all records to be approved, and there are some logical steps that you can take, and I think we have a video on what are some best practices that's already built in into the help area that talks about what steps you should take to do the approvals and how to do it efficiently. If you still need help, call the support desk and we'll be happy to walk you through it.
And actually, one of the handouts post-webinar is best practices for approved visits. So you'll walk away today with a guide from us as well.
Great. I'm looking at trying to hop back and forth between the screens here. Stephanie asked a question. Once a timesheet is approved, can you view it as a time card? Timesheet is approved. Can you? No, we don't have that capability, but Stephanie, I think that is a good idea. We'll take that under advisement. I think that's an easy enough addition so you can view time card view for approved time. That's a good idea. Thank you. Okay, moving on. Sam, anything else on approved visits that you want to cover?
Not with approved visits, but with admin time. We were going to cover some admin time here.
Yes, that's a good point. So caregivers as well as internal staff can use a new function called admin time, which allows you to, essentially it's non-billable time. And we implemented non-billable time to capture things like, training time for employees that you don't bill DHS for, but you still need to pay them. But what Mills and Andrea have done is they have really taken advantage of this capability. Andrea, can you tell everyone about how you're using this to eliminate what used to be paper timesheets that you had for internal staff?
Correct. So whenever admin time was launched, we dove in immediately and eliminated any paper time cards whatsoever. So within Pavillio, you're able to design your own categories. I believe we have, admin time, PTO, holiday, training. And so depending on what you're doing, you just go under that, do your manual entry. You can also do real-time clock-ins for those who like to do that. But now, since we use Pavillio only for our timekeeping system, we're now exploring how to download that information and import it into our HR company that we use. So we're looking to optimize that process now. And I know I'm kind of jumping ahead, but having Pavillio be the one-stop shop for us has been really beneficial. And once again, eliminating any need for paper time cards is both fantastic, not only for our payroll admin, but then also for, you know, the staff experience, just once again, going to one place, not multiple areas, so less confusion.
In under the, you know, that many customers kind of forget about the internal admin users or the internal staff and the timekeeping for that. So it's great to see that you've made use of it, and the system has the capabilities. Again, some agencies have a lot of internal staff, and this could be very useful. And we also have added mileage. Sam, we have mileage capture capabilities that people can use as well, right?
We do from session-based care currently, and it will be coming to one-to-one visits and not associated with a visit as well. That you'll see that in the coming soon. But yes, we can capture mileage.
And there's a question that came in: is non-billable time available in the app?
Also coming soon.
And coming soon, and we're doing an app update here shortly. I think in about another 2 weeks, another week or so, and then some of these, the app update doesn't really have a lot of new features. There's some internal technical things that we're updating app for, but the end of the month release, Himshan, is that when we have that plan for the non-billable time in the app?
Yes, it will be most probably the first week of the next month.
Okay, first week of November is when we'll have non-billable time. So, you know, all of this essentially is, you know, we are filling in the gaps of functionality that fully rounds out what the platform can do and helps pay employees, internal employees as well as staff, and takes away some of these spreadsheets that you might have, or outside of the system functions that you have or processes that you have. You want to bring them all inside so that you have this end-to-end solution.
Yep,
Okay.
and just continuing on here, Andre had mentioned, you know, exporting the time from from all of the visit records and non-billable into their HR system. And I know we're running short on time, so I'm just jumping ahead here into payroll. But we do have the ability in the system today to capture both the service time and the non-billable time and export that out for payroll. And we do have the ability to create a payroll template based on your needs. So it is simply an export out of Pavillio and an import into your HR or payroll system. The process is simple. You will select your pay dates, your payroll week, start date and end date. Have this box to include records not already computed prior to start date. So any late time sheets or anything that hasn't been computed for payroll already would compute. And then once the batch is computed, you would look to make sure it would be a pink line if there were any errors. You'd check those out, and then you can simply select the records and export them. And that will generate that file for you. And we have got several templates available for that already. Anything you want to add, Prabha?
Nope. Payroll computation and automation is a huge part. We do, with the customers who use it, see a lot of benefit. And, you know, Andrea, I believe you have the payroll person also is your biller, and this is something that you use, that you plan to use, and you anticipate quite a bit of time saved.
Correct. I mean, like I said, we're still in the process, but we are thinking that this will shave about 5 hours off of her time that she's currently manually doing from Pavillio. So we're really excited about that. And one thing that is hard to demonstrate within this webinar is, you know, we're talking a lot about tasks from the agency perspective and how Pavillio can help with all that time saved. We've been able to utilize our biller / payroll admin and put her towards other initiatives within our organization. Like we did our first DSP engagement survey and we're taking action on that. We redesigned the website. Like we're able to leverage her in other areas that you know, is great not only for the organization and the level of care we provide, but then also her experience, right? Just diversifying her workload. So it's been really beneficial.
Yeah, and she's human, and if you're taking the data out of here and you're entering it into another system, there's there's chances for fat fingering something. And if you can take the data directly out of here and push it into a payroll system, that'll greatly simplify it. And we are willing to create payroll export templates, even if we don't have them. Call the support desk and we'll create one for you so that you can simplify the payroll process.
Mm-hmm.
Okay, the next item on the list is billing. Sam, you're very close to billing and you're passionate about the benefits of billing. Can you talk a little bit about billing and how, and Andrea, if you could chime in on how this is helping you?
Yeah, billing in Pavillio is really where the magic happens. We are advertised as an end-to-end platform, but the billing ease and the cleaning up the claims, scrubbing the claims before they even go out the door is key here. So we won't do a big demonstration on this today, but the simplicity behind it for the user and the complexity of all the calculations and all of the checks that happen is huge. Pavillio does a 45-point check or so on all of the records that come in from the time record side when they come into billing. And we'll flag any issues before they're sent out the door. Once in ready, it's a simple one-click, select all records and then send a payer, and it doesn't matter, if it's different payers, different months, different services, you can select them all in one shot and send them out the door. And the billing area was really designed to be user-friendly and easy for any biller to do and to save time. So Andrea, yeah, maybe just weigh in on the time savings you've seen with billing.
Right. So once again, we have just over 100 persons served. So with this process, it saved our biller over 60%. So it went from an entire week down to a day and a half. It could be done in a day if everyone had their time cards in, theoretically, but it's really, it's a huge time saver.
Fantastic.
Moving on, reporting. Andrea, you've made good use of our reporting capabilities. We have a lot of reports in the system. In fact, sometimes I feel like we have too many reports. How are you using reports, and how is that helping you streamline operations?
Yes, so we use a ton of reports, so it's hard to name all of them in this amount of time, but I would say if as an agency you are doing, you're mining your own data, let's say, and you're like, there has to be an easier way, definitely reach out to the support desk. I've done this time and time again, be like, hey, we need our staff driver's license information for our insurance company, and I don't want to do this by myself. Is there a way, since we entered into the system, can you make a report? Absolutely. So that was a really small example, but if you're using the system and the data is in there, chances are there's a report. Even if you can't find it or see it, it may exist elsewhere and they can populate it in your dashboard within Redash. So
Sam, do you have some thoughts on reports?
Yeah, so just a kind of clarification too, we do have Redash, and we also have the reports option that I showed earlier on the left-hand menu. And that is a different reporting tool that we are continually adding reports into. So you'll see more options in there. And so if you do make report requests, they may be in one or the other, just as we continue to build out that function as well.
Okay.
Okay.
So moving on, let's see. Okay, so that covered all the items that we had on the list. We've got about 6 minutes here. I would like to use this, and first of all, I want to thank everybody for the wonderful questions. You guys have tons of great questions, a really engaged group of people today. Thank you for the questions, and if you guys have specific questions for Andrea, please drop them in the question section, and we'll try and get Andrea to answer them. In the next 6 minutes, I'm going to try and cover what's coming next. And we're constantly doing things to improve the product. all of this is based on feedback from you. A couple of things that I want to highlight here. There's more than this. This is the highlights. There's lots more that's happening. Configurable client override. Sam, can you show everyone what that is and how we're going to implement that?
Yes,
So,
actually, I have an image of this, yeah.
You have an image here. So
Yep.
we have a client override. The client override overrides a variety of things, but coming soon here within the next couple of weeks or so is the ability to override only certain things. As you can see, there are 5 or 6 things here, but there are many more items. You can selectively override one thing, but not override the other. This has been a frequently asked feature, and so we are going to implement this here in the next couple of weeks or so.
And one of the specific use cases for this, Prabha, if I could just jump in, is the folks who are under grants, are operated under like county paid SILS programs, private pay, who don't have MA eligibility, and you just want to override that feature, but you want to maintain the rest of the items. It's just one of the easy ones to highlight here.
Okay. Good. Moving on to the next item, emailing and faxing. Faxing, we've implemented faxes. Yay! People keep asking for faxes. We had them in legacy. We just didn't get it done, but we've got it done now, and it's a pretty slick implementation. Now, right next to email and print option and download option, you're going to see a fax option, and the fax option it means that document can be faxed out to the case manager. And again, we add a new feature. We're not coming back to you and say, pay me more money. It's included in your subscription, and it's a new capability that you can start using now. So fax is available, email is coming soon. Next item. Televisits. Televisits is already in pilot. We'll be rolling this out. This is for that small group of people that don't have a device and need to use a phone. This will be available in short order. Probably it's already in pilot, and based on, if you have a need for it, please send in a support ticket so that we can remember to inform you when it's available for you to start using. Next item. Sam, do you want to talk about the app, the new capabilities in the app?
Yep. These are the upcoming app changes. So we are breaking down the utilization within the app, both on the caregiver side as well as the client or RP side. So you can see the estimated hours as well as the hours worked by service line. Also coming soon to the app is the ability to capture that non-billable time, capture mileage and reimbursements, manual entry for shared care, session-based care. The caregiver questionnaire, those are available in the portal today, where you can select the list of questions that that need to be answered. That will be coming to the app, as well as offline capability.
Okay, next item. Skill services. In the past, we've said that we are delaying skill services, and we've been working hard on this. There are lots of pieces that's required for skill services. Someone in the questions asked, when are we getting EMAR? EMAR is coming at the end of October, and we currently already have ability to do 485s. The OT and PT is already there. OASIS is coming, but we anticipate having all skill capabilities completed by the end of the year. So we are already testing with some piloting some of these capabilities, but you will be able to do skill services out of Pavillio by the end of the year. Okay, in closing, Andrea, you've been immensely helpful in covering a variety of things here today. Well, what are some thoughts that you have in closing for the agencies that are on the webinar today that would be some good takeaways?
I mean, admin notes for sure. I imagine, unless there's a different, the more you can stay in Pavillio, I think the easier everything is. That's just really helped us communication wise and making sure that we're doing all that we need to do for those that we serve. And then once again, the approved visits is definitely a huge benefit to agencies, not only in the billing side of things, but then communicating with staff when things need to be adjusted or changed, for sure.
Excellent. As Andrea said, Pavillio is not just for billing and EVV. It's an end-to-end tool. There are lots of capabilities. We encourage you to use it. We are more than happy to train you or teach you how to use it. Contact us, and we'll help get rid of that spreadsheet. Call us and say, hey, I have such and such spreadsheet. Is there a way to do this in Pavillio? Call the support desk. We'll be happy to help you. We've highlighted many areas today. I'm hoping that today you'll be able to take away 1, 2, or 3 different things that you could go implement right away within your organization that'll help you streamline and improve operations. Third, use the how to help icon. There's lots of stuff there, and we're adding a lot more, and Christine's done a fabulous job of now adding some highlights with in the platform itself. If something is new, it's going to have a blinking light on it, so you know that something's new is showing up. So that's going to help you find some of the new features. Guys, we're nowhere near done with what we want to build. There's lots of new features that we've rolled out. We'll continue to roll out features, and everything that we're investing all the dollars that we have back into the platform so that we can make the platform better and better and be the best platform for your agency. So please take advantage of those new features when we roll them out. Let's see. And finally, there are some handouts. Sam, do you want to? Is that Christine? Is that available for people now, or how do they get the handouts?
Yeah, absolutely. The handouts are actually in the control panel under handouts, so you can download them from there. But
Okay.
no worries, we're also going to send those out in a recap email to everyone who registered and attended.
Perfect. We'll do that. And the important thing here is we do these webinars for you guys. You have some suggestions on what more we should do, tell us, and we'll then come up with more content for webinars. I see, for example, I see a question here from Tony. Is there anything in the works that will handle the SEIU spreadsheets? It's funny you should ask, Tony. I think we just talked about this recently. I'll take that to heart and we'll get that completed. I think we started talking about it, didn't finish it. So automating the SEIU spreadsheet is something that I think will help people. Christine and I have talked about this, so we will definitely take a look at it. And in closing, I want to say the Pavillio promise is we want to make this flexible. The platform is meant to bend with you and to meet your needs. Efficiency is important for us. We are constantly trying to make things. It's easy to make things easy is very hard, and we work very hard at making it easy. And we want you to be able to rely on us. Early days, and Andrea, you probably remember, 2.5 years ago, it was a rocky start for us, but now we process $100 million a month in billings. That's $1.2 billion worth of billing, and the platform runs beautifully and gets people paid. And we'll continue to keep the promise and keep working. Please send us your feedback and comments, and thanks for all your support, and join us again for the next webinar. Have a great rest of the day.
Thank you, everyone.